Hello class, this week I will be presenting a flashcard presentation on lung cancer. Let's discuss the disease process. Lung cancer is caused by damage to genetic DNA in the cells of the airway. Lung cancer can be caused by various reasons. For example, one cause is by inhaling environmental carcinogens or other damaging chemicals into the lungs. When the lungs are damaged, oncogenes can be triggered, and oncogenes are a mutated type of gene that causes uncontrolled cell growth and division or inhibition by tumor suppressor genes, which can help in slowing down cell growth and division or regulating apoptosis or cell death that is programmed. Cancer in the lungs is the most common cause of death by cancer in Northern America. According to Midthun, there are over 1.8 million deaths worldwide in 2020 alone, and in America, the statistics show 240,000 people with lung cancer diagnosed, as well as 100,000 deaths annually. Lung cancer affects people of all ages, but is predominantly diagnosed in people over the age of 65. Lung cancer is a complicated disease process that is researched extensively. Lung cancer can be called bronchogenic or alveolar based on the location of the cancer cells. It can be central, as in small cell or squamous cell cancer, or peripheral, as in adenocarcinoma. When the lung tissue is exposed to carcinogens such as cigarette smoke or environmental toxins, the lung epithelium starts to deviate from normal development in a process called dysplasia. With constant exposure to cancer-causing toxins, mutations in genes starts to damage the protein synthesis process. The cell cycle becomes disrupted, therefore creating a persistent carcinogenesis. The most common primary lung cancer in America is called lung adenocarcinoma. This type of cancer is considered a non-small cell lung cancer and primarily occurs in people with a history of smoking cigarettes. This cancer starts in the mucosal glands and lung periphery and is found in the lung where there is elevated chronic inflammation. Lung cancers are classified into 4 types, known as adenocarcinoma in situ, a minimally invasive adenocarcinoma, invasive adenocarcinoma, and variants of adenocarcinoma. Lung cancer is defined as cancer of the lungs where it would be primary and it has potential to metastasize or spread to other tissues and organs based on its ability. The risk factors for lung cancer include carcinogenic smoke, because when this smoke enters the airway, it creates damage to the lung tissue that lines the airway. When the cigarette smoke continues to damage the lining, continues creating a pathway for the carcinogen to enter the body, therefore mutating the DNA in the cells. Smoking cigars is a risk factor for cancer because the smoke inhaled is also damaging the epithelium, causing genetic cellular mutations. Secondhand smoke exposure is a risk factor for lung cancer because carcinogens released into the air are inhaled by a bystander, and this can also damage the epithelium in the lung and create genetic mutations that enable the lung cancer to develop. Radon exposure is a risk factor because this radioactive gas damages the lung and produces oncogenes, and this is what turns on the cancer-producing gene in the system that is already present, or it can also create havoc with the tumor suppressive genes. Another risk factor is inhaling asbestos, which can create a condition in the lung where the pleura is damaged to the pleura, which is known as malignant mesothelioma. Previous exposure to radiation by X-ray imaging to the chest is a risk factor for lung cancer because the radiation can damage genetic DNA in healthy cells, causing them to become cancer cells. Signs and symptoms include a new persistent cough, which is a sign because of airflow limitation to the lungs. Bronchiectasis is common because slow-growing neoplasms can cause permanent damage in the airways. Hemoptysis is a sign of lung cancer because the cancerous cells spread throughout the tissue, creating damage leading to coughing up the blood. Weight loss is a sign of lung cancer because the tumor cells release appetite-reducing substances that causes a decreased appetite, which leads to the cachexia that people are usually used to seeing with people who have either lung cancer or metastatic cancer. Symptoms include a new persistent cough because of the limited airflow in the lungs, chest pain, also because the tumor is growing in size, putting pressure on the nerves. Pleuritic chest pain is a symptom because frequent coughing can lead to muscle exacerbation and exhaustion, and possibly broken ribs, depending on how frequent and severe the coughing becomes. Shortness of breath is common because the tumors can block the airway or fluid can build up and making the lung expansion difficult on inspiration and expiration. A hoarse voice is typically a first common symptom seen because the cells in the voice box get irritated or injured by persistent coughing or metastasis of the lung cancer to the throat. Loss of appetite is common because changes to hunger signals based on increased demand for energy from cancer cells. Blood clots are also a symptom because cancer cells release clotting promoting factors and triggers blood vessel changes in formation, making the body abnormally clot. And also, lastly, persistent sweating and night sweats are a symptom of lung cancer because the metabolism is increased based on the body trying to fight off the cancer, producing an increase in body temperature. Diagnostic testing of lung cancer includes a CT or a chest computed tomography, which is an enhanced image using contrast. It can improve the evaluation of lung cancer by providing the tumor stage, lymph node involvement, and the stage of metastasis if lung cancer is suspected. Laboratory studies can be done, which include a complete blood count, electrolytes, calcium, alkaline phosphatase, and alanine aminotransferase, as well as creatinine and albumin. And these studies can show metastasizing in different organs of the body based on the abnormalities that are presented in the blood work. Sometimes also lung biopsies can be performed, as well as pulmonary function tests to see how much damage has occurred due to the cancer. So treatment includes surgical resection, which offers the best opportunity for long-term survival and cure in patients with a resectable non-small cell lung cancer. Patients with stage 1 or 2 disease who are not candidates for surgical resection or who refuse surgical intervention may be candidates for non-surgical local therapy, which can include radiation therapy. They may be applied by stereotactic techniques or conventional methods. For patients with pathologically proven stage 3 disease prior to definitive therapy, a combined modality approach using chemotherapy as well as immunotherapy is sometimes generally preferred. And subsequently, if there has been no progression, post-op adjuvant chemotherapy can improve survival in patients with a pathological stage small cell lung cancer. And disseminated disease in approximately 2/3 of patients at presentation are usually responsive to the initial chemotherapy, but are at risk for the cancer coming back and relapsing. So a lot of the times systemic chemotherapy is integrated as part of the treatment based on a lot of different variables and a lot of different factors. So that is typically the treatment options for lung cancer. And attached, I have my references here, and thank you so much for listening.